Hi everyone. Today we'll be speaking about vocal function exercises. After this presentation, we hope that you achieve a full understanding of this technique. My name is Debbie Zito.
And my name is Diking Liang.
And I'm Mary Keenan.
This presentation will include the history of vocal function exercises, the principles and procedures behind the technique, a video of Joseph Stemple and a client acting out the procedures as audio and visual support, evidence-based literature, voice problems this approach is useful for, and finally, a clinical case study. I would like to begin with a quote from Joseph Stemple. He stated that it is simple on the surface, but actually a bit complicated and something you have to practice in order to be able to do well yourself. So who is Joseph Stemple? I've in fact already mentioned him twice. He is a professor at the University of Kentucky. He is known for the technique, but he did not make it up. He used previous research and eventually formalized and developed the technique into what it is today. So then who did originally formulate this technique? In the 1950s, there was a man named Bertram Bryce. He was a professor at the University of Syracuse. He specialized in voice, and in addition, he was also a classically trained singer. Bryce believed that there was a direct relationship between the conditions of the laryngeal musculature and the quality of the voice. Bryce thought that if a person were to do vocal exercises for laryngeal muscles, that would be an effective way to improve the voice of individuals with vocal hyperfunction. He wanted there to be a dynamic equilibrium of intrinsic laryngeal muscles, specifically the cricothyroid muscle and the thyroarytenoid muscle. He suggested that they had to be balanced and strong in order for voice to be normal. As you can see, they're highlighted in this diagram. The Bryce therapy program was split up into 3 different phases: the dehabiting phase, the muscle retaining phase, and the stamina phase. The dehabiting phase included identifying and eliminating any vocal habits that are abusive. The muscle retaining phase's goal was to alleviate the tension of the vocal folds and muscles such as the thyroarytenoid and the cricothyroid. Then, the stamina phase was dedicated to train these laryngeal muscles to endure more than what an untrained voice can typically handle. Now I'm going to explain what the Bryce exercises entailed. First, the client was to sustain the vowel E for as long as they could, as soft as they could on the musical note E, C. So they would go something like this. E, and they would do that until they ran out of breath. Next, the client should glide from the lowest to the highest note on the vowel O. So it goes something like this. O. Then they would go from the highest to the lowest vowel. So it'd go like this. So it'd go from high to deeper. Finally, the client should sustain the musical notes C, D, E, F, G for as long as possible on the vowel O, kind of like this. O. All of these exercises were instructed to be performed 2 times, twice per day. Any more of this could make a person feel fatigued. So now the question is, what happened to the Bryce therapy program and why is it called the vocal functional exercises? Well, unfortunately, when Bertram published articles conveying his discoveries, he made some mistakes when describing the muscle function. These errors made much of what he had to say discredited. After, people updated and changed them, leading them into the vocal functional exercises, which is what they are today. They were no longer the Bryce therapy program. The main component that was added was the factor of resonance. Voice is a compilation of respiration, phonation, and resonance. Bryce only focused on respiration and phonation. The Bryce exercises instructed the client to produce the tones as softly as possible. This instruction often leads to a disengaged, breathy tone. This type of voice production restricts the normal amplitude of vibration, which ultimately diminishes the training effect of this exercise. Additionally, the semi-occluded vocal tract was added. The efficacy of the vocal fold vibration is enhanced when the phonation is occluded downstream from the sound source. This mouth posture of the occlusion improves the subglottic air pressure with decreased intraglottic vocal impact stress. Essentially, the semi-occluded vocal tract unloads or releases vocal fold tension, which permits an over-ease of phonation. So the ultimate goal is to remove the pressure and excess tension of the vocal folds in order to produce a healthy voice. Next, Z King will explain the up-to-date procedures.
Now let's talk about the principles and procedures. Vocal function exercises are a series of systematic voice manipulation designed to facilitate return to healthy voice function. This exercise strengthening and coordinating laryngeal musculature and improving efficiency of the relationship among airflow, vocal fold vibration, and subglottic treatment of phonation, which also known as to improve the relationship between your respiration, phonation, and resonance. According to ASHA, exercise should complete twice a day during morning and evening time in sets of 2. Maximum phonation time goals are set on the basics of individual lung capacity. Individuals are advised to use soft, engaged tone and are trained to use a semi-active vocal tract by the lip bus without function during voice production, which means the voice is engaged and not breathy, and no hot guttural attack at initiation of phonation. The placement of the tongue is forward and the pharynx is open. Specific speech stimuli are selected to help achieve placement of the tongue and pharyngeal opening. The tongue should not be musculated at the larynx, but rely on interaction between abdominal contraction and breath support. Practice consistency is encouraged. The vocal function exercise consists of 4 exercises, which are 1. Warm-up, 2. Stretching, 3. Contracting, and 4. Power exercise. Now, let's talk about the first exercise, warm-up. In this exercise, the client is required to perform a maximum phonation test on the vowel E. The client should try to sustain vowel E as long as possible in order to engage the vocal mechanism and emphasize the extension of respiration on the production of voice. During this exercise, the client should take a full breath and start off at mid-range on an F note to say the E from mid to full volume as long as she or he can. For female clients, they start on the musical note F4, which also known as 349 Hz, and also known as above the middle C note. And for men clients, they start on the musical note F3, 174 Hz, and also known as below the middle C note. E is going to help our vocal fold to come together efficiently. The goal is sustain E sound as long as equal to the length of maximum sustain of the S sound. And now let's talk about exercise 2, stretching. During this exercise, the client should glide upward from the lowest to the highest note on the word no, using tongue or lip chew. The goal is to go slow and no voice breaks during upward pitch glide. Stretching of the vocal fold, increasing flexibility and muscle coordination. The client should feel a yawn-like posture of the oral cavity. Now, let's talk about exercise 3, contracting. In this exercise, the client should feel glide downward from the highest to the lowest note on the word no. Focus on half yawn in the throat, where pharynx open, and the client should say it slow, systematic with a growl at the bottom and no muscling of the tongue allowed it. The goal is no voice breaks during downward pitch glide. And last, let's talk about the final exercise, power exercise. There is a low impact auditory power exercise. In this exercise, the client is required to sustain the muscular 5 notes C, D, E, F, and G for as long as possible on the word no minus n, which makes the O sound like the word O, but without the D, as quietly and as long as she or he can. For female clients, they should begin at the middle C octave, and the male clients, they should begin at octave that's below the middle C. The exercise focuses on an open pharynx and constructed vibrating lips, and the goal is to sustain as long as maximum sustain as production. And now let's take a look of the vocal function exercise example from Dr. Stimpleton.
The purpose of this presentation is to provide for you a tutorial, and this is a tutorial for clinical practice and also for teaching purposes. It's designed specifically to introduce to you the concept of physiologic voice therapy, and in particular, the therapy program known as vocal function exercises. You're going to sustain the vowel E for as long as possible on the musical note. What we're going to have you do is make it a nasal tone, which will put the point of constriction. Good. Okay, now we're going to play with that because that's what position I want you to be in. There you are. Feel it?
Yeah.
Okay. So what we would do, of course, is time each one of them, and for the sake of the video, we're not going to time each one, but I want to go through. The hardest thing, especially for singers to do, is not to sing the exercise, and you're not.
Okay.
And you don't like the tone at
No,
all, do you? Of
not
course
at all.
not. Of course not. But that's precisely what you need to do. And remember, it's not a singing exercise, okay?
Okay.
It's a physical exercise for the mechanism. All right. Exercise number 2, we need to stretch the vocal folds, okay?
Okay.
Not only do they vibrate like this, but they stretch to give us our higher pitches, they contract to give us our lower pitches. We need to work out those muscles. Third exercise that I want you to do, since we've stretched, what have we done so far? We've warmed up the system, we've gotten you into a nice forward focus with that E, we've unloaded the larynx, we've given you kind of a relaxed vibration, though engaged, okay? We've stretched the vocal folds very nicely. Let's contract them, okay? To contract the vocal folds, we're going to do the exact opposite of what we did in the stretching. I want you to glide from high to low, comfortably high. It doesn't have to be your highest note because you'll probably hyperfunction to get your highest note. Just a comfortably high tone, but to your very lowest note. Again, on the word knoll, it'll sound like this.
Vocal function exercises are useful for many voice problems, including but not limited to vocal nodules. In an 8-week program of a modified vocal function exercise program, women with vocal nodules show significant improvements in acoustic measures such as increased fundamental frequencies, as well as decrease in shimmer and noise harmonic ratios. The emotional subtest of the Voice Handicap Index also had positive ratings, as speech perception were perceived as being less rough and less strained. Presbyophonia, which greatly affects our elderly population. A random control study of vocal function exercises in 16 elderly participants showed improvements in voice-related quality of life questionnaires post-treatment. On the other hand, the study also concluded that vocal function exercises did not show any changes in measures of phonatory effort tests. Vocal fold atrophy. 8 weeks of vocal function exercises, in addition to vocal fold hygiene education, resulted in positive effects in endoscopic glottal closure, scores of the GRBAS scale, and Voice Handicap Index. In the study, researchers also included participants with other medical histories, such as smoking, yet improved vocal quality of patients with vocal fold atrophy was still made, suggesting that vocal function exercises is still an effective treatment for patients as long as background diseases are managed during voice therapy. Muscle tension dysphonia. Stemple described a case study of a teacher that experienced gradual loss of vocal quality due to intense use, improper care, and chronic throat clearing. In addition to recommendation to environmental changes and proper care techniques, vocal function exercises was introduced to focus on the easy onset of voice to straighten vocal folds. Daily practice was monitored, and after completion of 6 weeks of vocal function exercises, the patient reported less instances of vocal fatigue and objective measures showed an improvement. Vocal fold paralysis. Patients with unilateral adductor vocal fold paralysis show improvements in glottal closure, decreased voice qualities of breathiness and monotone, decreased acoustic measures of jitter and shimmer, and positive changes in aerodynamic measures. Additionally, better self-reported ratings on the functional scales of the Voice Handicap Index. And finally, vocal function exercises are useful for anyone with normal voice production to increase lung capacity, maximum phonation time, and frequency range, as well as decrease airflow rate. One clinical study showing the effectiveness of vocal function exercises is Saunders et al.'s vocal function exercises for presbyteritis. Researchers noted that voice disorders are common among the elderly population, with 29% of non-institutionalized seniors reporting having disorder. Presbyteritis, or age-related structural changes to the vocal folds, adversely affect vocal function and quality of life for the elderly. As a result, Saunders et al. Wanted to examine the effectiveness of vocal function exercises as a primary treatment for presbyteritis. Participants of the study included 9 participants ages 65 and older that were diagnosed by an otolaryngologist and SLP with presbyteritis. Participants underwent 6 weeks of a behavior voice therapy program involving vocal function exercises. Pre and post therapy measures included an acoustic analysis in which audio recordings of the rainbow passage, sustained and maximum sustained ah was analyzed, an auditory perceptual voice assessment in which the same recordings were rated by graduate students to indicate overall severity, breathiness, and strain of speech samples. Self-rated scales included the Voice Handicap Index and phonatory effort levels. And finally, visual perception assessments tracked the open and closed phase of glottal closure. The results of the study showed that for auditory perceptual ratings, readings of the rainbow passage post-treatment were perceived as less breathy and strained. For self-rating scores, there were significant reductions in the mean Voice Handicap Index scores and phonatory effort levels. On the other hand, acoustic measures, laryngeal images, and maximum phonation time showed no significant differences. The authors did note that previous studies had suggested lack of correlation between acoustic and patient-based measures. They quote, acoustic measures serve as an impairment level assessment, whereas handicap measures such as the VHI are sensitive to voice-related restrictions in participation and activity, reflecting the experience of the person who has the disorder. So even though acoustic measures did not show any differences pre and post treatment, the overall decrease of self-perceived handicap, effort, and severity proves that vocal function exercises can be used as a potential primary treatment plan to improve functional and perceptual characteristics of voice in the geriatric population.
Thank you for listening. Hope you can use this in the future. Bye.
Bye.